So I'm going to be talking to you. I'm changing hats from what you're used to hearing from me about, to talk to you a little bit about the patient side of things. And I actually had a really great opportunity to dig more into this in the last several months. So feel confident in me, though you're not used to hearing me talk about this. So the first thing I want to talk about is patient access. We're going to talk about services and quality, but at the end of the day, we can set up the most amazing system. If patients aren't finding us, and if patients can't get appointments, none of it really matters. So first, we're going to look at what new patient registration has looked like. Pretty dang good. So this you're seeing the last 2 years. Also, to really give you a sense, in this orange box is the last year and how very different it looks from the year before it. So a couple kind of really important events that have been plotted out here. I just realized I'm moving my cursor, but I'm not sharing my screen. But you'll see the first one in Enlace. So I think I saw Beth on here, who's going to have her first Enlace clinic next week. This is our second microsite that we opened in Little Village, and started to see a spike, had a really big impact in our month 1 there. Then a next spike you see, thank you, Katie, for Dana waiting for me. The first migrant bus arrived in Chicago. The busing actually did start over a year ago. And we were able to do some work getting patients in, and we did a vaccination clinic at one of the hotels where people were being sheltered. Steph mentioned in the strategic plan a really concerted effort in outreach, building that infrastructure. Laura's new position, building up a multi-person outreach team now, where we have 4, 5, feel free to correct, 4 outreach workers whose sole focus is to be out in the community and providing other education classes for patients, which we had one. And I know Rosia was on the call. This change was just starting when Rosia was with us, started as a volunteer, joined the team. And so this has really morphed and evolved so that we can do all of the work and the spikes that you see throughout the most recent business year that we just closed. So you'll see a very strong start to year 2024, which started in October. But investing in that staff and that infrastructure was critical to allow us to do the work that you see really reflected once we started to get into the warmer months. And then you'll see where our migrant response begins, the weekly mobile health clinics, where we were registering patients, scheduling them for in-clinic visits, just massive increases from what we were used to. And I will mention that is not all of what you're seeing in those spikes. That is also summer months are busy outreach months, and we had 4 people out at the consulates, at health fairs, at community events, making sure that we were making those connections, building that trust, and really ingraining ourselves further into communities with teams that represent them, so that we're able to get patients who need the care connected to care at Community Health. So this is data. I will also say you're going to see a couple slides that look kind of like this. This has been another really exciting shift at Community Health, is just a much stronger grasp on the data side of things and really being able to understand and visualize and make decisions based on the trends that we're seeing. So if this is a popular event and we do it annually, as I hope to, you'll continue to see what these updated numbers and trends look like. And we very much anticipate it'll look a lot more like these recent plot points of really increased growth, connecting to new communities, opening in new communities, so that patients are able to register with us and access care. So these are just some other things we look at that I think actually impact you all quite considerably in your work with the clinic, to make sure that, great, we're registering all those patients, can we see them? So we want to make sure we have enough appointments available. So all of our amazing primary care providers who are on the call, and the interpreters who interpret for them, and the triagers who manage flow throughout, we need to make sure you're all there so that all of those patients can actually access their appointments, both their new patient visits and then those regular follow-ups once they become established. So you can see we've put up what our goals are for the coming year. These were just confirmed on staff. That is the minimum needed, just as an FYI. If you notice, what we finished with last year is on the right, that it looks like a little reduction. That's to have exactly enough. We know that there are other things like patients cancel, so we need a couple extra appointments, some availability may mismatch. So that's our minimum. We're very confident that we will reach it, and we'll do it thanks to you all. So be on the lookout for all of our recruitment requests, and we need more providers to fill our 3 exam rooms at Onward House and all of that exciting stuff. The next piece is continuing that trend that we just looked at with new patient registrations. So we've set a goal to increase what we do this year and to register 1,300 new patients at CommunityHealth. So that is a nice, ambitious goal, and one that I think we're really well set up to reach. You all will receive, some of you may already have an email, and it'll be in the huddles in 2 weeks. We have some really great new outreach cards. The staff all just shared our experiences with it at the staff meeting a couple hours ago, to equip all of you to also be our outreach team and share with patients and help connect to care. So a lot of new kind of innovative approaches coming up to make sure that we are bridging those gaps wherever we can. We also want to make sure that patients can actually schedule appointments with us. So they registered with us, we have the appointments available, but can they fill them? So we want to focus on a couple things, one of which here is that if we register all of those patients, are they actually getting in to see primary care? And we've set a goal to have, I believe it's hovering around 82% of patients who register actually get in to see primary care. That's not far off from what we did last year, but it is also an increase. And I'll talk about a couple tools that we have coming up to make sure we really can make that easier for our patients. And then finally, this is something that we're really going to be digging into for the first time in detail this year, is returning patients. So also making sure if we do all of that work, we connect patients to care, we get them in, we establish that we don't lose them unnecessarily due to the administrative burdens Laura described with Medicaid redetermination. We can, yes, thank you, Steph. We can do things differently. We can be more proactive or reactive as needed to make sure that we have the tools our patients need to easily stay in care. So some new kind of tech tools that we'll be looking at in that space as well. And then finally, on the access piece is wait times. So we have the appointments, we have the patients registered. Are the appointments in a reasonable amount of time where they're actually appropriate for what our patients need? So these are some of the goals that we set for both primary and specialty care. We want a new patient to be able to be seen within 5 days of requesting an appointment. You'll see the goal at the bottom and our current status larger at the top. So currently we're 2 days out. This is something we check every single week since it's a moment in time measure. And we really want to keep very close eye on this because we know it changes quickly. If we go and have a new mobile health referral partner, this number changes really quickly. So we're keeping a close eye. Same goes for follow-up. Again, we're a medical home, patients establish care. We want to make sure they have ongoing access to care. So we want them to be able to get a follow-up within 3 days of requesting it. And we're currently at 2 days out. This is another one that varies very much week to week. And then on the specialty side of things, we pull out 3 focus areas each year. As you all hopefully know, we have over 20 specialties, and we keep a close eye on all of them and want to make sure that we have really meaningful access for any care that we're saying we really provide. So this does not encompass everything, but our 3 that we feel, 1, are really critical to our patients. 2 are often ones that we struggle a little bit more with, and we want to make sure that we're putting even more attention on. And 3 ones we feel we can make a difference on. So for this year, we are focused on gynecology, which we're actually in really quite good shape with a 2-month wait. And we really just want to make sure we maintain that. The goal was 3 months in the last year. So we've made good progress and now just want to make sure we don't lose it. Physical therapy, any of you who I think are at all close to patient care know that this is a huge need and always a huge challenge for us, and has been the focus area every single year I've worked at CommunityHealth of the ones that we look at. So we're hoping to get from 4 months to at least 3 months. I believe I mentioned the provider I talked to this morning, who's hopefully going to lead to a really exciting new partnership. So I'm really confident we're going to make a significant dent on that wait time so patients can get into physical therapy sooner. And then finally, GI is a new focus area for us. Tell your GI friends, please. This recruitment is going to be a big part of making an impact here. Our wait time is quite high, currently sitting at around 6 months. We're very lucky to have an amazing volunteer GI provider, Dr. Vanagunis, who also reviews those referrals. So he's helping on that side to make sure they're all appropriate. We're not stacking up a list needlessly, but he's one person. So we really want to make sure that he has a little bit of support so that patients can get in more quickly, with a very ambitious goal of 3 months, which really is 3 months is our goal across the board. Anything over 3 months for specialty wait time is generally too long. So we're really going to push hard to get there. Those are our wait time goals. I'm going to shift a little bit on the patient side now just to cover patient experience. So we do a patient satisfaction survey, just like we do a volunteer satisfaction survey for you all. And we actually have some really fresh data to share with you. Very quick overview. We have 18 questions. You can see some of the focus areas that we hit on. General satisfaction, provider and staff communication, telehealth satisfaction, customer service. So really trying to hit pretty much every aspect of a patient's care at Community Health and their experience. It, like everything else that we do, is available in English, Spanish, and Polish. And it is sent electronically. We used to do these exclusively by paper and then have to data enter every single one individually. And that is just not realistic for us at this point, though we have made adjustments to make it as accessible as possible, despite the shift to an electronic version. So these are sent out via a texting tool that we have that allows us to text with our patients. And this one is just fresh from October. You're good. So here are a couple, I'm not showing you everything, but a couple of things that I think will be especially feel relevant to our volunteers, starting with some bright spots. So the first, how easy is it to get in touch with us? This you can see highlighted. That means board of directors, our board key performance indicator. That's something that we share with our board as well to make sure that we're making moves on. Has long been a huge challenge for our team. We are growing our team, but we're still a lean team. And our patients are also very phone dependent as it stands right now. And so there's a really high volume of phone calls for everything from a question that goes to the nurse to changing the appointment. Once our patients get on the phone, they also usually want to make the most of that time. And so those calls can become very long. So this is an ongoing challenge for us. We recently changed phone systems and are really excited to see already a 3% increase in patients' ability to get in touch with us. And this doesn't flat highlight phone. I'm going to talk about a couple other communication tools that we are also really trying to lean into to take the burden off of those kind of person-to-person phone calls. Next is the quality of phone or video visits, knowing that telehealth is very much here to stay, ranking really high. So amazing job, providers. I know that sometimes telehealth can feel a little bit challenging, but know that the patients are not feeling it. They're feeling really well cared for when they're connecting with you for a phone or video visit with 95% positive ratings. That's astounding. Really, really high, especially noting too that telehealth, we had to really pitch to our patients too, as did all healthcare providers when we went a lot harder into it during the pandemic. So this also shows, a lot of great work and communication on all sides to make the most of this tool. And then finally, another huge props to our providers. How often does your provider explain things in a way that was easy to understand? 96% positive rating. That is like astounding numbers, really, really astounding. And I especially want to flag like all that goes into this. It's not just your clinical knowledge, it is adjusting things in a way that our patients will understand depending on where they are in their health journey. If it's a new diagnosis, it's bridging the language barrier and making sure that we're able to translate this through the use of an interpreter. This is also where our interpreters get a huge kudos, because if you were not doing your job effectively, none of this would actually make its way to the patient and vice versa. So communication is everything in patient-centered care. And I just want to say, amazing job. Opportunity areas. Yes, Clara, amazing work. Some opportunities for improvement, which are still, not dismal by any stretch of the imagination, but we always want to make sure that we're looking for opportunities to improve. And sharing a couple of these that I also think will resonate with those on the call today. First, how often did someone talk to you about the medicines you were taking? That one did take a little dip. I'm sure that we will have some huddle updates and ideas coming up in the next months of how we can make sure that this is being featured in your visits, whether it's making sure patients bring their meds with them to the visit, whether it's communicating with the pharmacy. We can certainly make some moves here. Interpreters, I share this with love. Do not worry about being in the red. That is still A, a really high ranking, and B, when we already know we have plans in effect as of this Monday to really make a significant impact here. So we really, and this was a newer question added in the last year or so. You all are such a crucial part of our team and of what the healthcare experience is like for our patients, that we really wanted to learn from our patients what it's like. Whether it's a matter of technology issues, whether there's more training we can provide you all, we really want to be drilling down there. Telehealth, again, would you want to connect in the future? This is kind of a funny one because they love it, but they're still maybe not wanting to have their next visit that way. And that's fine. You know, we'll continue to look at how to improve our telehealth setup. But I think we learned this through the pandemic too, and with the microsites, is that it was very telehealth heavy at first. People want to be seen in person, and providers often want to see their patients in person too, and that makes sense and is needed. So making sure that we have, as Steph said, choice, we have options, and all of the choices are really high quality is our goal. And then finally, looking at kind of whole health, has being a patient at Community Health allowed you to reduce the amount of work or school you missed due to being sick? A very minimal dip here of 1%. But I wanted to share this with you also, just so you know what we look at. We're going to drill down into more detail in a second. I'm going to show you some of our quality measures. But this is, what is the impact on your life, on your well-being, on your quality of life, on your ability to be present in your life outside of community health? And 73% is still really nothing to sneeze at. So sharing that with you there is good news, and also is something we'll continue to monitor to make sure that we're not losing ground there. Lots of good kudos here. I won't read them all out, but we want to end on a high, and it's always just so nice to hear directly from patients. My favorite is very plainly, great clinic. This is what we need. Like, great. We're filling the needs. We're doing a lot, offering so many different services and offering them at a really high level. A lot of shout outs for staff being very helpful. I want to remind you all as volunteers, they're talking about you. While our patients do know our model and that we're, a training program, we have volunteers, and I think a lot really love that about us. I wouldn't say the majority are making those nuanced, differences when qualifying a staff versus a volunteer. So anytime we see patients talking positively about staff, we include all of you in that consideration. And then I think the last piece for me on patients, some of the improvement plans for some of those kind of slightly lower numbers that we have coming up. Making sure patients can get in touch with us is not just about the phone calls, but using technology, using passive communication where we don't have to be there present in the moment. So for those of you who've already been helping with this, thank you. We do have a patient portal that allows patients to communicate with staff, with providers, soon to schedule appointments by going online and logging in. There'll be more coming up on this very soon, as one of our really wonderful residents, St. Joe's residents, wants to do a project on this. To improve this. I know, Kate, it happened. So more to come on patient portal. Within that, turning on self-scheduling. So we just had one of our hopefully final pre-planning meetings today to say, yep, we're ready. So that we can flip a switch, and patients who are established and have access to the portal don't need to call us and wait for someone to call them back to schedule an appointment. They can log into the portal and schedule their follow-up visit. And it's just that simple. So we're really excited about that, and we'll keep you all posted when it goes live, so we can all kind of be watching for what's working and what could be better. Telehealth, we have Ring Central, so our new phone system that also allowed us to set up phone access before this week, which is now just way better, but phone access in all of the exam rooms so that providers were not having to use their cell phones to connect with their interpreters or complete their phone visits. It also professionalizes things so that the number shows up as Community Health's number when patients receive a call, which is really important. And then just continuing to provide support for our providers around telehealth best practices, which I think we'll dive back into in the coming months. I think we've kind of let things move as they have been for a bit. And then I'm personally vested in this 2+ year long journey that came to its very exciting fruition Monday of this week, which is that we now have, I wish I was at the clinic right now to show you it, but a tablet in every single exam room, not just a tablet, the newest version of an iPad. Like, we got the top level set up. They were newly restructured to be used exactly for the way we're using them, so that all of you beautiful remote interpreters across the country or even local who are used to being on a speakerphone, on a provider's cell phone, they moved around the room, are now on a really beautiful rolling cart, able to see the patient and the provider. They can see you, the video quality is there, the audio quality is there. And this is what is the standard in healthcare. And I think for us, again, it's really important that there are no sacrifices that we're saying it's okay, you know, that we do it this way as a free clinic. We kind of have to work within different means. That's true, but it shouldn't stop us. So I am just so excited that is all up and running, and we'll hope to see what the impact is the next time we send this survey out on how they're feeling. Finally, I wanted to share the outcome side a little bit. So this is what the patient's experience is working within the clinic, what's actually happening, what is happening in their care. So we focus on these 5 quality measures regularly. We report on these quarterly. Any of our continuity providers get these reports from Milan. There's new ones coming out next week. And so what you're seeing here, you get your provider scorecards. These are clinic-wide, focusing on cancer screenings and then a couple key measures for our chronic conditions. And the main thing I really want to call your attention to is that rightmost column, which shows just an outstanding difference between the statewide federally qualified health centers, so Medicaid population numbers, and what Community Health is able to accomplish. The only one where you see that they're the same at 46% for breast cancer screening, everyone took a hit because in the last year, the recommended age went from 50 to 40. And so the group of patients who we needed to catch up with and get screened grew quickly. So we are making headway and we'll continue to really push on that in the coming year. But all of these other ones, we are outperforming the FQHCs by a lot. And that is really thanks to everyone on this call. Thank you, thank you, thank you. I know sometimes it's just the clicking and it's a pain in the butt, but it makes all of the work you're doing show up here so we can really acknowledge the progress that you're all making. So really incredible, 81% cervical cancer screening, incredible. Colorectal screening, 66%, 22% over what the state average is with the FQHCs. And then looking at BP control, 70%, still well over what the state is looking at. And then for our diabetic patients, A1C control at 75%. So these numbers are really, this is the comparison. You don't just have to believe me when I say that they're really incredible. We are outperforming, and we're doing that in what you could call a limited resource setting. We're doing that with patients who have a lot of barriers outside of the time they're with you in the clinic to make sure that they can get to their mammogram appointment that's going to be at an offsite referral partner, or do all of the things they have to do to bring their BP under control or their A1C down. So just a massive kudos to everyone who's helping us reach these outcomes and just improve our patients' wellness and lives.